Hello, everyone. My name is Quinn Terry, and today I would like to discuss with you the unique needs and vulnerabilities of transgender men and women. So, here are the learning objectives for this presentation. You'll be able to accurately identify the difference between sexual orientation and gender identity. You'll also be able to identify how transgender men and women are marginalized in society and in healthcare. You'll be able to describe the Texas hate crime law that failed Malaysia Booker. You'll also be able to describe two barriers transgender men and women face when getting quality health care. And you'll also be able to describe how nurses can help with healthcare disparities. So just the introduction to the topic for transgender men and women. A transgender individual's gender identity, or how they view themselves, is different from their sexual assignment at birth. So if they were born with male or female physical characteristics. A trans man is a person assigned female characteristics at birth, but who identifies as a man. A trans woman is a person who was assigned male characteristics at birth, but who identifies as a woman. Now, when interacting with transgender individuals, you will always want to ask them their their preferred personal identifiers. So whether they would like to be addressed as he or she. Some outdated terms that you will not want to use is the term he, he, transvestite, or it. Those are seen as very derogatory and disrespectful. Now, transgender is not the same as sexual orientation. Sexual orientation is who a person is attracted to sexually, so whether you're attracted to men sexually or women sexually. Transgender is the gender identity of how they view themselves, whether they view themselves as male or female, regardless of their physical characteristics. So transgender men and women are marginalized in society and in healthcare. So we'll focus on society first. So in society, there are laws that discriminate against gender identity. The first one I think we all remember, the Public Facilities Privacy and Security Act of North Carolina. A lot of us remember that as the bathroom bill, where individuals in public facilities could only use the bathroom that corresponded to their sex on their birth certificate and not the gender they identified with. And also hate crime laws. Now, hate crime laws are supposed to protect transgender individuals, but in the case of Malaysia Booker, it did not. Malaysia Booker, who is a trans woman, meaning she was born male but identified as female. She was brutally beaten on videotape. Her attacker beat her just because she was a trans woman. The video was uploaded to Facebook and it went viral. Now, her attacker did go to jail, but he could not be charged with a hate crime because Texas hate crime laws only cover sexual orientation and not gender identity. Her attacker was released from jail. And a little bit later, maybe a few weeks later, Malaysia was found shot to death. Now, police did not find any relationship between the attacker being released from jail or Malaysia's death. But if her attacker could have been charged with a hate crime, he would have served more time in jail. Also, there's a high probability for the transgender community to experience violence. Now, the National Transgender Discrimination Survey reported that 26% of their respondents reported being physically assaulted solely on the basis of their gender bias of others. So being marginalized in healthcare. Now, up until 2019, the World Health Organization treated transgender individuals as having a mental disorder and not having a medical condition. And so that really impeded on health insurance coverages or seeking medical help because they thought that they would be looked at as having a mental disorder instead of having an actual condition. Also, healthcare coverage exclusions. Now, some insurances will not cover preventative treatments for like pap smears or annual exams. So to break that down, if a trans woman, meaning they were born a male, but identifies as woman, has identifiers as female on their identification or insurance cards, but they need preventative treatments that male would normally get, such as a prostate exam, because remember, they were born with male genitalia. So insurance companies will look at that and see a female getting a prostate exam and not covering it, not knowing that the person who identifies as female was born male and is entitled to those preventative treatments. So, some social justice issues. Now, social justice, as we learned, is based on the principles of equality in which the worth of every member is respected and valued. Now, according to the CDC, many transgender people experience stigma and discrimination in their day-to-day lives, and that can affect their access to healthcare. Excuse me. Transgender women of color are at an increased risk for experiencing violence and harassment, even in healthcare settings, which is very troubling. The CDC came up with this illustration here that showed that transgender individuals are 77% more likely to be mistreated at school, to be physically attacked, verbally harassed, or denied equal treatment at 48%, and to be mistreated at work, 30% more likely. Now, access and quality of healthcare. So, the biggest barrier to the transgender population is access to healthcare. The National Transgender Discrimination Survey reported that 40% of respondents had medical coverage. Only 40%, and that rate was even lower for minorities. And the illustration here from the CDC shows that compared to the general population, transgender individuals are at a higher rate for HIV infections, substance abuse disorders, mental health problems, and violence and victimizations. So these impact their health and they have a barrier to accessing healthcare. Equality of healthcare. Back to the same fear of discrimination from healthcare professionals, cost of healthcare, and discriminatory exclusions. So, solutions to health disparities. The solutions I discovered are can be more so nurse driven. So, the first one we're talking about is activism. So, that's voting on public policies and laws that increase access to healthcare for not only transgender individuals, but all individuals facing healthcare disparities in vulnerable populations. Also, increasing awareness. Now, that can be in our community or in our colleagues at work. So, letting our colleagues know about vulnerable populations and how we can help them. Advocate for community resources. Now, with the biggest barrier to healthcare being access, we can talk for clinics, community clinics, mobile van services, or home visits. This increases access to healthcare for vulnerable populations. Education for the population as well. So that's our primary, secondary, and tertiary. So we're talking about primary care visits or screenings or even treatment. Education for healthcare professionals is another one. So for healthcare professionals not to make assumptions and to show respect. It makes really no difference to gain access to healthcare when you feel that your healthcare professional doesn't respect you. I mean, you're not likely to go visit a doctor you feel doesn't respect you. Here are some community resources that I discovered. Now, I live in Harrisburg, so some of these community resources are in Harrisburg, but there are some in Lancaster as well. So the first one is Adler Health Services. Now, this is a primary care and mental health service that's focusing on benefiting underserved LGBTQ populations, and a lot of their services are free of charge. And then you have the Lancaster LGBTQ Coalition. Now, they are committed to building a supportive and enriching community, abundant in opportunities for the LGBT community, as well as creating a more inclusive Lancaster County. And then you also have Trans Central PA. Now, this is more so focused on transgender individuals. So Trans Central PA is committed to providing advocacy and caring support for transgender individuals and their significant others and families. And they also provide education and information for business organizations, educational institutions, and government agencies on how to interact with the transgender population to make it a more inclusive organization. And here are the references I use for this presentation. I thank you for viewing this presentation, and I hope you learned something about the vulnerable population of transgender individuals. Thank you. Bye.